Welcome back to the King's Podcast, The Wellness Dive with Lackie. I'm your host, Esther Lackie. Today we are joined by Dr Menna Farouk, emergency pediatrician at King's, and she'll be taking us on a deep dive on how to deal with emergency situations at home. Welcome, Dr. Menna.
Thank you.
Please tell us what you are about, what it is that you do here at King's.
I am a pediatrician with a special interest and a specialty of pediatric emergency medicine. So in King's, we are having a pediatric emergency. A lot of patients coming to the pediatric emergency department. So I am one of the doctors here handling these cases when they come to our hospital.
How often do you see emergency pediatric situations over here at our ED department?
Most of the cases coming to the emergency department are mainly due to febrile illnesses like fever and infections. But of course, we have a lot of patients attending emergency department after accidents and home injuries and other kind of emergencies in children. They are a lot, and almost maybe 30% of the patients we see every day are due to accidents and trauma and injuries.
How serious are they? And if parents knew how to handle them at home, would that help?
Of course, because the parents are the first caregivers, and they are the first people who are in place of emergencies. And most of the children emergencies happen at home. There are a lot of studies and the statistics approved that many cases of emergency happen initially at home. So definitely when the parents have any knowledge of how to do the first aid, how to help in the cases of emergencies, definitely they will be of a great help to the kids, and they might decrease the severity attending the emergency.
Okay, and you said if parents or caregivers knew how to handle these situations, it would actually be helpful.
Definitely.
Actually life-saving.
Of course.
How can they do this? Especially, let's say, the parents are working and they have the nanny at home. How can this work out?
I recommend that all children caregivers, whether the parents, the nannies, the teachers in school, nurseries, or older siblings, to get to know the basic life support and the basic information regarding the first aid. So there are a lot of courses that are being given to non-health professionals to help the parents and whoever dealing with children to have the basic knowledge how to manage such emergencies at home.
Yeah, I believe at King's you also offer such classes here?
We do offer some classes from our life support department for new parents specifically, to help them how to deal with it when they have a newborn, and for older children as well.
If you're interested in knowing more about our first aid courses, please call 04-247-7777 for more information. Now, Dr. Menna, we are going to get down into the nitty-gritty of emergency situations at home.
Yeah.
So when it comes to, let's say, falls, trauma, cuts, and wounds, how should a parent react or a caregiver? What should they do? What's the first thing that they should do?
First thing, don't panic. So this is always my advice to all parents. Don't panic. So because you can think straight if you panic. First of all, after you assess the situation, make sure that the child is in safe situation in terms of, for example, let's say there's a fire. So you and the child has to move out of the place where there is a fire, or the child he cut himself. So of course the basic things to do is to apply pressure on the wounded limb or wounded area, stop the bleeding. If the child fell from height, make sure that there is nothing around him that can fall again, like for example the drawers, other furniture, and stabilize. And always, whenever you have a case of emergencies, it's better to contact the ambulance or to get help until you reach to the hospital.
And you'll be there waiting for them.
Exactly.
Yeah. So let me ask you, does the ambulance call ahead for you to be there when they arrive with the child?
Yes. We have, with a Dubai ambulance, we have a specific communication channel that whenever a child is being brought, or any patient is being brought from home or from anywhere else, they notify us ahead. So we will be ready, and we, according to the patient's the condition severity, we will be ready at the time the patients will arrive. So we know ahead.
Okay, back to the cuts and burns. I remember when I was a kid, we were told the first thing to do in case of burns is to run the target area under cold water and maybe apply something like Colgate?
Yes.
How true is that?
So if you have nothing at home for burns, like the first aid kit for burns, at least get the burn under lukewarm water, just running water. It doesn't, no ice, just room temperature water. Profusely wash the burnt area, and don't cover, don't do anything, and if there's any bully, don't puncture, and just come to the emergency to reassess it.
What about the cuts? I remember one time I actually got cut when I was a kid, and the caregiver at that point poured sugar on the wound.
Sugar, yeah, this is interesting. I know about coffee, I know about toothpaste, I know about mud, but
You've
sugar.
never heard of sugar?
No, I've never heard of sugar. But anyways, no, don't put anything like coffee, mud, sugar. Just apply pressure. Keep the area clean. If, for example, due to dog bites, because we have lots of people around us, the pool of population around the King's Hospital, they might have pets at home. So, for example, like dog bites, just wash thoroughly, and don't cover. Just come to the emergency.
How serious does the wound have to be for the patient, or rather for the guardian or the caregiver, to bring the child to the emergency department?
Of course, simple cuts and superficial cut wounds and abrasions, there is nothing serious about it. But if it is in the face, in the neck, or near a joint, if it is deep, if it is multiple, or it is opened, or if there is also accompanied by a fractured bone, then they have to come to the emergency.
So if it's just a simple cut,
just wash it, clean it, dressing.
Put pressure, dress it, and
put
on a band-aid, as they call it, a
yes.
boo-boo.
A bombo.
Yeah. Okay, let's come to choking. Apparently, choking is an emergency situation and it occurs quite often. How does that actually happen? Because I really don't understand how a child can end up being choked.
Well, children are very curious creatures. And in the first 2 years, when the child starts to crawl and explore the whole world around them, the first way they get to know what their surroundings are is by putting things into their mouth. So it's by the oral route.
It's the oral choking.
Yes,
okay,
oral
that's
route.
Understandable.
Then they want to taste, they want to feel, they want to know what this is. For example, we see a lot of cases with coins. So they have the coin in their hands, and just in a second, they put it in their mouth, and sometimes they end up choking with a coin. Or if they are eating and coughing, and then they can get some like foreign body in their airway, in the air pipes, and then it ends up choking. And of course, it is an emergency. Then it comes to the basic life support courses that we offer for parents.
How should they go about it?
Because it's very important. Yeah, because it's life-saving. You can be in a restaurant and you can find a patient, a child or an adult choking. So there's a universal sign for people who get choked, which is they put their hands on their neck and they cannot cough and speak. Then the first aid is to do Helmick maneuver, which is, even if you don't have to take the course, just go to the YouTube and see how it is performed on different age groups, and it can be really life-saving. But there are other things that might children, they put in their mouth, and it is not as like an emergency for the parents. For example, they might just swallow a battery, which is in the small toys, disc batteries. They can swallow a battery. Actually, battery, it is one of the emergency things that has to be seen to the hospital, because they might later on they can make some erosion and in the gastrointestinal tract. So a battery, for example, is something that has to be seen in the emergency, regardless if choking or not. Multiple magnets. Some other toys, they have multiple magnets, like small pieces of magnets. If small pieces of magnets have been ingested, they should come to the emergency. Sharp objects, of course, or big things.
Yeah, which reminds me, I remember my mother telling me one day, sometimes spoke about a story. She could feel bad breath coming from my big brother's nose, but she didn't know what it was. So they went to the ED, and the doctor said there was some pee stuck in there. So does that happen often?
Yes, it does. Actually, we have a lot of cases coming with foreign body in nostrils, in ears, because they are very curious to have it in their hands and might just stuck it somewhere. And yes, for the nose specifically, we can diagnose it just by having one side secretions, offensive smell. then we always suspect foreign body in the nostril. So whether we inspect and we see ourselves, or we do an X-ray to make sure there is no metal object in the nose.
Would we call that an emergency situation, or should the parents or the guardians know how to handle such a situation from home?
Yeah, well, if it is something simple and you see your child putting things in their nose, there is a very simple technique. We call it the kiss technique, that the parents can just blow in the mouth of the child, obstructing the nose, the side which has no foreign body, and then the foreign body will be pushed out. So if they can do that at home, well and good. If not, come to emergency and we'll get it out.
Yeah, but then again, the children might not be able to explain what's actually wrong with their nose. They cannot tell the caregiver that they've put something inside their nose. So as a parent or a guardian or a caregiver, how can you recognize such a situation?
Well, just as you said, which is a true story, with offensive smell coming out of the nose. Yeah. So yes, or snoring, which was not there, for example, or audible breath sound that was not there before. The child was playing, and then all of a sudden they come to the mom and to the father and with an abnormal breath sound. So then we need to suspect foreign body in the throat. So they need to come. Sometimes they come to us and saying, this piece, it had 3 parts and now it's missing 1 part. I don't know, we suspect that they have put it or somewhere or swallowed it.
Let's go down to poisoning.
Yeah.
That is, I hear it's pretty common.
Yes. Yeah. Actually, which is surprising about poisoning, that a colleague and I have done a research on poisoning in kids in Dubai. Mm-hmm. We have investigated 570 patients almost for attending emergency departments. And we found that more than half of these patients have been ingested a poison at home. And the most common poisonous agent that was ingested was the detergents, the household, like the washing liquids and stuff like bleach and all these things, which is unfortunately can be of the reach of a child. So they go for it and they swallow it and ingest it. Mm-hmm. And of course, more striking that some of the Clorox, for example, and all these things that the parents sometimes they put it in a bottle of water, like in bottled water. The child thinks that this is a water and they drink it. So
you'd advise against the guardians, the caregivers, the parents removing the detergent from the original packaging into a bottle of water.
Exactly. And because also the bottle and the packaging of the detergents are made in a way that it's a safety for child safety. Mm-hmm. You have to squeeze it and push it down and to open it. But if you put it in a regular container, it might not have this option. Mm-hmm. So the children will have access to it and they will ingest it. Also the makeups and all the mothers and things that they use. Sometimes the children, they also swallow it and eat it. The nail polish remover and all these things. Mm-hmm. So poison in children, it's common, mm-hmm. mostly happening at home, and with the thing that we less expect them. Yeah. And of course, when the child goes to, for example, they go to the grandparents. So at home, you make sure that your medicine and whatever medicine you have is kept away.
At your home, the home is child-proofed.
Exactly. But when they go, for example, visiting friends or grandparents, this might not be the situation. Sure. So the kids can have access to more dangerous medication. Mm-hmm. Like for older people, anti-diabetic medications, antihypertensive, which is really can be a problem. So keep medicine, keep all these things away from children. Anywhere.
Before they come to the ED, I'm sure it's going to take a bit of time before the ambulance arrives.
Yes.
What's the first thing that the caregiver, parent, or guardian should do after the child has ingested such poison?
One of the common mistakes that parents do, that they try to make the child vomit, to throw up. So
why is that bad?
They think, because you don't know what they have ingested. For example, if it is something which you call corrosive agents, like the detergent things, you don't want it to be back and forth in the esophagus, in the diet pipe. You don't want to have it to come back again. You don't want to make more burn to the lining of the gastrointestinal tract. So don't make the children vomit, and stabilize as the situation needs. If the child is unconscious, of course, they have to call the ambulance immediately and come to the hospital for reassessment.
What about
Charcoal.
The thing of taking milk.
Yes, milk is fine as well. If you have access to the milk and the thing that you can give it, so yes, try to give it. But of course, there are many things, many medicines and many agents that will not help with giving milk.
So basically, how does the milk help?
Because it will neutralize the acidity of whatever they have taken. So if something has an erosion effect, the milk will neutralize this erosion. It will decrease the erosion. Something very interesting also came newly to the literature and the medicine, that to have honey in case of battery ingestion. So if the children have ingested batteries, which is the disc batteries, let them eat honey. It will help in decrease the effect of the battery on the gastrointestinal tract. And charcoal, which is charcoal sometimes also. Charcoal, it is, I think it's over-the-counter medication that the charcoal, if the child has taken some medicine. So if you can access the charcoal and give it to the child within 2 hours of arriving to the hospital, this also might help.
Drowning. From media reports, I think most of the hotels ban the children from swimming
on their own without
exactly.
Yeah, of course. This is
what happens when a child
this is of course
feared drowning.
We see it a lot, specifically when we have a pool at home or in the hotel, or it's a new environment that the child will not be attended by the parents all the time. So it needs an immediate intervention, of course. CPR then comes to help the cardiopulmonary resuscitation. And again, basic life support.
All right.
So prevent and then try to help.
What about when it comes to febrile illnesses and seizures?
Fever is one of, as I said earlier, that it is very common presentation to the emergency. The parents really panic because of fever, and more severe when they have the child who has fever and start having seizures at home.
Convulsions.
Yes, which is, we call it febrile seizures. Febrile seizures per se, it is self-limited. It will take maybe 1 or 2 minutes maximum, and it is not harmful for the child in the situation. However, when the child has high fever and then starts to have abnormal body movements, the best way is protect the head. The child will not fall down when shaking. Put the child in what we call a recovery position. So aside of the child, try to keep the head extended to a little bit to the back to open the airway. Don't worry, just sit next to the child, be calm. You can call the ambulance and come to the hospital. But usually the children will take 1 or 2 minutes and they will recover, they will have full recovery, and conscious level will come to the normal state.
I can imagine a parent panicking after seeing
of course.
The child having a seizure.
Yeah, it's really frightening.
Speaking of seizures, how can a parent differentiate the febrile seizures from epileptic seizures?
Febrile seizures usually happen with fever. So it's a fever which starts and then the convulsions happen. But epilepsy usually comes without fever, and it can happen when the child is completely himself or herself, like there is no illness, no viral infection, they have been playing and then all of a sudden they have abnormal body movements or abnormal stare. So they have been talking to you and then all of a sudden they just stop talking, and just for a few seconds they black out. So this kind of abnormal movements should be evaluated by a pediatric neurologist and make sure that it is not epilepsy. Febrile seizures, usually it happens with fever and it can recur, but usually doesn't recur in the same febrile illness. So the same infection now can happen once, doesn't happen again. And of course, the assessment of the pediatrician is very important.
All right, doctor. Thank you so much for joining us today.
You're welcome.
But just to be clear, you, if a child comes to the emergency department, you're the first point of contact.
Yes, I am.
I love the colorful look. We have Superwoman there.
Yeah, we're trying to give a good experience to our children.
All right, thank you, doctor. Thank you for coming in.
Thanks a lot.
Thank you for joining us today, Dr. Menna, our emergency pediatrician. Anytime you're coming to King's ED with your child, she will be the first point of contact. And to know more about our first aid classes again, as a caregiver, as a parent, as a guardian, please call 04-247-7777 for more information. Until next time, see you. Bye-bye.